Well, it's great to be here today. First off, I drove down from Tampa yesterday. It's a bit cooler there, so I really appreciate the warmer weather. And second, this is just an amazing audience. Really appreciate the fact that so many of you are here. In light of busy schedules, it's midweek, so it goes to the issue at hand and the importance of having community involved in these efforts. I want to thank the board and Dr. Dehaney for inviting me here, Julia and Brittany for helping me prep for the presentation, and the rest of the staff from the Community Foundation, and everyone here at this beautiful pavilion for organizing the event. I also want to give a shout out to, there is a contingency of USF folks here. Let's say yay. So that's really important for me in light of the fact that, we have the support of a really highly ranked university that's ascended very quickly in a short period of time. So I want to talk a little bit, first of all, about myself, just very briefly. So here's a picture of me back in 1991. I had carrying less weight, and my hair was a lot darker. So how did I get involved in this line of work? A lot of people ask me that, and it goes back to when I was a student, maybe even before then, growing up in New York. And as a student, I was really interested in the intersection of nutrition and health and environment. So when I was doing my doctoral research, I landed up in Lesotho, which is a small landlocked nation, completely surrounded by South Africa. And I was studying how different types of households, mostly moms and children, coped with and showed resilience in the face of seasonal food scarcity, what we know as a type of food insecurity. And this was the early 90s, which says a little something about how old I am now. And I was, there was a lot going on at this time. South Africa was transitioning into a democracy. And what I learned at the end of the day was, there are a lot of events that go on in the world that have an impact at the local level. And I think that's the way we also have to approach food insecurity. It happens here on the ground, but there are a lot of external factors as well. So to start, I want to just present a definition of food insecurity. It really is a social condition. It has to do with unlimited or uncertain access to food, and it has the potential to affect health throughout the lifespan, affect child growth and development, and all of the things that we heard about earlier. So often when people think about food insecurity, they think about hunger, and that's correct. If you're chronically hungry, you're food insecure. But I think the bigger issue here in the United States and other countries as well is that you can also be overnourished and food insecure. You have an unbalanced diet that's high in fat and sugar, highly processed foods, and that's attributable to the fact that people buy less expensive food when they're on a very limited income. They need to pay things like rent and their medicine, so food is often the first thing that is compromised. So food insecurity is, it occurs a number of different ways. So when we're designing programs to eliminate food insecurity, there are certain requirements for food security. One is the physical availability of food. Is the nutritious food in your, nearby? Is it in the market that you go to? Second is, do you have economic and physical access to the food? Do you have the money to purchase the food off the shelf? Do you have the transportation to get to the market? Do you even have the time to go out and shop and prepare a meal for your family? Often that's not the case. The third requirement for food security is what we call utilization. And that's not only the knowledge that people have about healthy food and preparing nutritious meals, but also the food storage that they have, proper refrigeration for food safety, utensils, basic things like that prohibit people from being food secure. So it's not just about getting food to people, it's about providing them with the knowledges and the knowledge and resources to be food secure. And if those three requirements are met and they're stable, then you have a food secure population. So here are some data on food security in the US. There's a time lag always. So I have data from 23 and 24. And as you will note in the graph, and probably know this already, food insecurity increases and decreases as the economy goes. So, during the Great Recession, we saw a big increase in food insecurity, and then it declined as the economy improved, and so on and so forth. And especially, I think, during and since the pandemic, there's been, much increased awareness about food insecurity. So, today, it's even higher now, but about 18% of children across the nation are food insecure. That's higher or lower depending on where they're living, where they come from. Okay. And it's about 13.5% of all households. So consider that this is significant in light of the fact that the US is the most food-rich country on earth. Okay. In Florida, again, the national data, 13.5% of all households. The food insecurity rate is a bit higher, at 14.4%, and most notably, it's increased over 3% since 2022. So that's concerning. And then in Palm Beach County and Martin County, you see the rates there. They are lower than the Florida average, but nonetheless still significant. And then the graph on the right shows Florida vis-a-vis other states in the US. And as expected, and as we know, food insecurity tends to be higher in the South than elsewhere. Okay. So this is very concerning, this data I'm going to share with you. The United Way has created this measure of what they call a survival budget, right? And this is just the basic, or the minimum that you need for the basics, like food, housing, your taxes, so on and so forth. So if you look at Palm Beach, for a single adult, the bare minimum income has to be about $42,000 or $21 an hour. And for a family of four, it's over $108,000, which is, I think, comes out to about $54 per hour. So again, a significant number of folks in these two counties and throughout Florida and the nation are just at the survival budget. So it's not just homeless people, it's not people who are unemployed. In fact, the number of people who are food insecure that are employed is growing. And some data, and this data, by the way, comes from United Way. There's this acronym ALICE. It means Asset Limited, Income Constrained, but Employed. And it shows that in Florida, about a third of all households are ALICE households. They meet the bare minimum to get by, and they don't have enough to thrive. Right? So these are the most vulnerable groups of people who are food insecure. I already talked a little bit about children, and that's very concerning because early insults on child growth and development have lifelong effects. And I'll talk more about that in a minute. Seniors, a large population in the United States, and especially in Florida, about 15% of seniors are food insecure. Again, it's higher or lower depending on where people live. We have the compounded issue of people are elderly, living alone, being isolated, and that compounds the health problems that they may have. Veterans, very significant, long-standing problem, and not only veterans, but also military families, relatively high rates of food insecurity. And then I just mentioned college students because that's a bit surprising. Very high rates of food insecurity. We did a study a few years ago that we published on about 1,700 college students from Florida, and the food insecurity rate was even above 40%. And the really important part of this was, aside from being food insecure, was that we then looked at the relationship between food insecurity and academic success, academic performance. Food insecure college students tended to have lower grade point averages. It took longer for them to graduate. They had more mental health issues. And we know higher education is very important in the state of Florida. We get, basically mandates from our leaders that, we have to graduate students on time, and we have to get, they need to have the skills to be properly employed and earn a decent living. That's really difficult when students are faced with chronic food insecurity. Okay, so already you've heard a little bit about this, so I won't go into a great deal of detail, but there is a clear link between food insecurity and health. Obviously, there's poor nutrition, and in the case of the US, yes, there is hunger, and that's a problem, but the bigger issue is the connection between food insecurity and diet-related diseases. Diabetes, hypertension, heart disease, even some cancers. People who are food insecure are more likely to have these diseases than people who are not food insecure. There's also psychosocial data that's a lot of it. It's really accumulating now, showing anxiety, depression, concerns about having food to put on the table for your kids. And it results in, again, these mental health issues. And then even what we call psychobiological effects, like on cognitive function, real concern for older adults. Data showing, immune deregulation, where the immune system isn't operating properly, and even on the gut microbiome, all those good bacteria in our bodies that help us to absorb and digest important nutrients. We've done research showing that the gut microbiome, the bacteria, differs between food secure and food insecure college students, for example. Now, lifelong effects of food insecurity, lower academic performance, absenteeism. We see behavioral problems in youth. And then, again, this is across the lifespan. College students, and in the workforce too, higher absenteeism, reduced productivity, workforce shortages. And a lot of industry partners are addressing this now. I was just talking with someone from Bank of America, and they are a great supporter of hunger relief programs here and in Tampa Bay. And I think they recognize that it may not just affect the larger population, but also employees. Right, so we have this double-barreled emergency, right? About 14 to 13.5% of Americans are food insecure. 60% of Americans have one or more chronic conditions. Again, it could be diabetes, it could be hypertension, and so they're occurring simultaneously, right? If we just were able to provide proper nutrition to everyone who needs it, that could prevent up to 600,000 deaths annually. So you imagine the, of course, emotional effects that has on the families who lose loved ones to these diseases, as well as the economic impact. So on the right, these are costs in billions of dollars for treatment of these diseases and lost productivity, approaching $1 trillion annually. And this is one of the reasons, our healthcare premiums rise as well, is the fact that it costs a lot of money to treat people who have these diseases, and we have to do more in terms of prevention. So, some not so good news to share with you, right? But I think there's a lot of great stuff going on, and I'm very hopeful. In 2020, we established our Center for the Advancement of Food Security in Healthy Communities. This center was recognized as a statewide center in 2021, recognized by our Board of Governors, who oversees higher education and USF. And we've grown, significantly in the time that the center has been established. So here's our mission. It's a bold one, basically, to eliminate food insecurity and improve community health. Right? So these are the things we do, what we call translational research, and basically the idea is to do research and translate it into programs that are effective, all right, and are measurable. That's really important. I work with a lot of small, nonprofits and even some larger ones, and they don't always have the capacity to generate the data to show that something working or areas for improvement. And you need that data to get funding and to make the case. So we work with a lot of partners on again, program development, program evaluation, education. We run symposia and workshops, not only for USF faculty and students, but for the larger community. We contribute to policy discussions. There's a lot going on with regard to legislation around hunger. I'm part of a committee that's out of the Department of Agriculture in Florida, and we're working on, and a lot of there are folks here in this audience too, are working on, policy. A lot of great programs going on, but they're not always sustainable because there isn't a dedicated source of funding for them. And then I think most importantly for me is training this next generation of researchers, leaders, and advocates. I am so impressed with the students that I work with who are not only bright, but so dedicated to this issue. And many of them experience, as I said, food insecurity, or they see it in their family and their friends. So this gives me great hope for the future. Okay, so I want to just talk about a couple of projects. This is, we've done more than 20 projects in a very short period of time, and they cut across the lifespan. They touch on different populations. So I'm going to talk about the food prescription project that we did, and then Health Buddies. But before I do that, I should mention that I think the timing really is right now to act. And a lot of good work has been done, and certainly everything that I've heard and read about what the Community Foundation here is doing is really important. But I think the timing is right for even more to be done. So some recent surveys show that 80 to 90% of Americans recognize the link between diet and health. And maybe even more importantly, nearly 90% of them prefer approaches using food instead of taking drugs, taking medicine. So I think the public is really on board with this. It's bipartisan, all right? And in this day and age, that's almost unheard of, but I think across the nation, people really are buying into this idea of food as prevention and for treatment and management of diseases. So food is medicine. There are many different types. Basically, you're delivering food to people and other resources like education to reduce food insecurity, improve dietary intake, improve physical and mental health, and to reduce healthcare costs, which we're all struggling with right now. So FoodRx, this was a partnership between Feeding Tampa Bay, our food bank in the major food bank in Tampa Bay, Elvira Health, which is health clinics that they have throughout the counties in Tampa Bay, or several of the counties, and then Humana, the health insurance provider, actually funded this project, and I think there's recognition among a number of these insurance providers, on the ethics of making sure that people have, it is a right to have food to eat and eat properly, and also it reduces the bottom line. Again, as I was saying, you can reduce the cost of healthcare significantly through prevention and treatment, as with food as medicine. So we did a study, enrolled 330 patients, and 203 enrolled in the study. We followed them over a year. Right? They were given, there were on-site food pantries they can go to and get food. They were also given $25 per week vouchers to redeem at the clinic or at mobile food pantries that were run by Feeding Tampa Bay. And then we followed the patients over the year. This occurred during COVID, so there were lots of challenges. Nonetheless, we did lose folks, people who dropped out for lots of different reasons. was a very difficult time, as you can remember. But the results, I think, are really significant. We looked at health clinical data, and we saw just improvements in food security and blood glucose for folks who had type 2 diabetes. I think the main takeaway, the main result I didn't mention in the slide is that the more people redeemed food, the better the outcomes were, right? So we actually have a beautiful chart that shows redemption. Frequency of redemption is associated with better health outcomes, right? Health Buddies. This is a great program that's run by one of our partners, Seniors in Service. So there are the partners listed there, and we studied the program. That's Aria Garling, who was an undergraduate student at USF, who's now a graduate student who I'm mentoring. She was the project manager. She works for Seniors in Service. It's a 12-week program for older adults. They get home-delivered meals. And I think maybe one of the most important aspects, aside from the food, was that people would get weekly phone calls from USF college students. And they were just check-ins. It could be chats, it could be video or phone. And that, we're studying the data right now, but I can tell you for the quotes and comments we're getting back, that may be the most important outcome. Remember, a lot of these folks are isolated, they don't have that much contact with the folks out the outside world, so that weekly connection. And this goes to the point that food as medicine is not just about giving people nutritious food. There are all these other needs, and I and others are really pushing for what we call more multidimensional food as medicine programs. So I just want to end by saying that I'm really hopeful about the future. I think the increased awareness about food insecurity since the pandemic it's easier to reach people. The research shows us that these food as medicine programs are efficacious. They can work if properly designed and implemented. And there's such positive energy, synergy among nonprofits, industry, right? Higher education. Even in the food system, I was just talking to someone about farmers who are contributing or donating food to these programs. So from food production through consumption, there's a lot of buy-in. And I think now, here today, you can help with this. I'm really positive about the future in light of a very chaotic world that we live in. So I think I'm going to end there. Thank you very much.
Thank you very